Exercise Unit 5. Write sentences to describe the work of the specialist in each branch of medicine. Look at B opposite to you. Dermatology. A dermatologist specializes in diseases of the sick. Rheumatology. A specialist in diseases of the joint. Traumatology, a specialist in accident and emergency medicine. Pediatrics, a specialist in diseases affecting children. Obstetrics, a specialist in managing pregnancies. Exercise 2. Complete the table which word from A, B, and C opposite and relate form. Put a stiff man in the front of the string in each word. The first one has been done for you. Bears, non-person, non-activity or he. Diseases, a specialist, a specialty. Practice, practitioner, practice. Consult, consult, consultation. Assist, assistant, assistance. Graduate, graduate, graduation. Qualify, qualification. First, preposition in C opposites that can be used to make word combination with the word in the book. They use the correct form of the words to complete the sentence. A pathologist specialist in diagnosing disease through examining care and tests. A pediatrician most usually working with children. An oncologist is interested in the diagnosis and treatment of cancer. A physiotherapist must be good at counseling. A neurologist must be good with her hand. Make word combination using word from each book. 2. Word can be a C, teaching. Look at A, B, and C opposite to help you. Consulting room, general practitioner, group practice, health center, internal medicine, surgical specialist. Exercise Unit 6. Make word combination using a word from A but look at A, B, and C opposite to help you. Associative specialist, house officer, on call, provisional diagnosing, radio progress, workroom. Make the description 1-5 with John Leaves. A looked at A and B opposite to help you. Dr. Warren have been a pediatrician for 8 years and is responsible for teaching in children admitted to what 60. The answer is consult. Dr. Stewart has just started the second year of her combination program. The answer is SHO. Dr. Shin has stayed in the training is a surgeon. The answer is specially registered. Dr. Shield has just graduated and is working in a Yardley hospital in Britain. The answer is pre-R House officer. Militar. Dr. Militar is Jones of the medical staff in the British hospital. The answer is medical director. Are the following estimates true or false? Find reason for you answer in A, B, and C opposite. A medical graduate because registered 2 years after graduation. The answer is false. The system of training doctors in Britain is called the Foundation Program. The answer is true. The name Serious House Officer is long used in Britain. The answer is false. The consul is usually the first doctor to see new patients. The answer is false. When working in shield, a doctor takes one to be on call. The answer is false. Complete the test or prior describing her job. Look at A, B, and C opposite to help you. When to get the work, first thing I do is tell the home office who has unduly during the last shift to find out if there have been any new admission. Then I guarantee the change nurse. He tells me if there is anything that means to be done urgently, sure as intravenous limb to put or take down. Later in the morning, I clean any new patient with Vaseline involving taking a history. On Tuesday and Friday morning, the consul does her work from and I have to make sure I'm complete to due date on her patient. After them, there are usually lots of things to do, like worrying you refer for ball stay and so. In the afternoon, I have to prepare for any patient who are to be discharged the next day. There's usually happy to be going home. And then, of course, there are the lecture and tutorial in the training program of Monday and Wednesday. Exercise Unit 7. Complete the sentence. Look at A, B, and C basic to help you. Someone who is specialist in delivering babies is a midwife. Someone who is qualified to acting is a clinical social worker. Someone who is not qualified but is able to act nurse is a nursing auxiliary. A nurse who has qualified is a staff nurse. A nurse who specializes in health promotion is health visitor. A nurse who looks after a ward is a chain nurse. A nurse who works in the community is chain nurse. Someone who answers the work telephone is ward clean. Make the word combination using a word or place from each book. Look at the opposite to help you. Carry out a product. Change a design. Clean the temperature. Give an injection. Remove sutures. Complete the sentence with the correct grammatical form of perfume. A soap Brian Keynes is painless and in million to perform. Biopsy of pancreas has performed last month. If the patient condition deteriorates, a laparotomy should be performed. If a diagnosis of meningitis is superated, a lumbar puncture must be performed. Last year, we performed large double in group state. Complete the sentence with the correct grammatical form of carrier. A new interact to carry out a large student. Informality, few poorly contained trials have been carried out so far. A number of students has been carried out recently to look at this qualification. A right hematology was recorded at a patient has meal after recovery. His producer can be carried out in the emergency department. Exercise Unit 8. Make word combination using a word from each book. Look at A, B, C, and the opposite to help you. Ambulance technician, artificial limb, club bot, contact lens, health professional, intraocular presume, occupational therapist, social work. Whilst alien health professional could best help to following people, look at A, B, C, and the opposite to help you. A young married woman who has just had a baby. The answer is social worker. A woman who is having difficulty using her right arm following a future tree, someone who needs glasses. The answer is physiotherapist. An elderly woman who has a below knee amputation. The answer is optician. A man whose wife has Alzheimer's disease. The answer is prosthesis. A man with a foot infection of this feet. The answer is social worker. Complete the test. Look at A and see opposite to help you. A prostate work with patients of all ages as member of a clinical team. Patient of the large hospital. The patient may need a prosthesis, the result of an accident or amputation following a disease such as diabetes. Alternatively, they may have been born without a limb or disease where a nurse, doctor, nurse, physiotherapist, and occupational therapist to give the people under their care the best possible rehabilitation. Their main aim is to enable the patient to learn and normally live off work and leisure. And orthodoxy work in a clinical as part of an outpatient service and also visits other centers to provide a service for people with specialist needs. They deal with people of all ages. For instance, children which have cerebral palsy may refer spleen to heliotown, while any meal others people needs especially shows to correct before if they mean any part of the humoral system may require some form of audition. The other C mean the needing to reposition the body or to relieve pain.